Why you can't sleep tonight, PTSD and insomnia. Hello, I'm Dr. Ninth Tail. If you're just joining us, I recommend watching the previous videos first. We've already talked about what insomnia is, why sleep is important, physical causes of insomnia, stress, anxiety, and depression. Today, we're going to discuss another condition that can have a profound effect on sleep. Post-traumatic stress disorder, or PTSD. When people hear the word PTSD, many think only of soldiers returning from war. But PTSD can happen after many different kinds of traumatic experiences. Not everyone who experiences trauma develops PTSD. But for those who do, sleep is often one of the first things to suffer. So, what exactly is PTSD? It is a mental health condition that can develop after someone experiences or witnesses a traumatic event. This could include combat, physical or sexual assault, a serious car accident, childhood abuse, domestic violence, a natural disaster, or even a life-threatening medical emergency. While many people experience fear, anxiety, or distress after a traumatic event, most gradually recover over time. With PTSD, those symptoms don't fade as expected. Instead, they persist for months or even years and begin to interfere with daily life, relationships, work, and sleep. One question I hear is, if the traumatic event is over, why does my brain keep bringing it back? That's a great question. The answer is that your brain isn't trying to make you suffer. It's trying to protect you. Think about what happens when you touch a hot stove. You immediately pull your hand away. Your brain remembers that experience, so you'll avoid touching it again. That's how learning keeps us safe. Trauma is different because the experience is so overwhelming that the brain sometimes struggles to file it away as something that's over. Normally, after a frightening experience, your brain eventually says, "That happened. I survived. It's in the past." But with PTSD, the brain can get stuck. Instead of treating the trauma as a completed memory, it keeps acting as if the danger could return at any moment. It's almost like the brain forgot to move the memory from the right now folder into the long ago folder. Deep inside the brain is a small structure called the amygdala. Think of it as your brain's alarm system. Its job is to detect danger and help keep you alive. After a traumatic event, that alarm system can become extremely sensitive. At the same time, the parts of the brain that normally help reassure us that we're safe may not calm the alarm as effectively. So even something that reminds you of the trauma, a smell, a sound, a certain place, or even a date on the calendar, can cause your brain to react as if the event is happening all over again. Now, imagine trying to fall asleep while your brain believes you need to stay alert. Sleep requires your brain to feel safe enough to let its guard down. But if your alarm system keeps saying, "Stay awake, stay ready," something bad could happen. It's no surprise that sleep becomes so difficult. Some people have trouble falling asleep because they feel like they need to stay alert. Others fall asleep but wake up repeatedly throughout the night. Many experience vivid nightmares or distressing dreams that cause them to wake suddenly. Sometimes people avoid going to sleep altogether because they're afraid of what they might dream. Over time, lack of sleep can make PTSD symptoms even worse. Poor sleep increases irritability, anxiety, difficulty concentrating, and emotional distress. Many people try to cope by staying busy until they are completely exhausted. Some drink alcohol, hoping it will help them sleep. Others spend hours scrolling on their phone because they don't want to be alone with their thoughts. While these strategies may seem to help temporarily, they often make sleep worse over time. So, what actually helps? The most effective treatment usually involves addressing the trauma itself. One of the best studied therapies is trauma-focused cognitive behavioral therapy, where patients gradually process traumatic memories in a safe and structured way. Another effective therapy is EMDR, which stands for Eye Movement Desensitization and Reprocessing. It helps many people reduce the emotional intensity of traumatic memories. For people whose biggest struggle is nightmares, there are also medications that may help in selected cases. Just as importantly, maintaining healthy sleep habits can support recovery. Avoid alcohol as a sleep aid, even though it may seem to help at first. Create a calm bedtime routine that helps your brain recognize that it's safe to rest. Your brain is doing exactly what it was designed to do, trying to protect you. The problem is that it's protecting you from a danger that has already passed. With the right treatment, your brain can learn that it is safe again. And as healing happens, sleep often begins to improve as well. Before we finish today, I'd like to practice a simple technique that many therapists teach people with PTSD. This exercise won't erase a traumatic memory, but it can help remind your brain that you are here and you are safe right now. If you're driving or doing something that requires your attention, you can always come back to this exercise later. Let's get started. Take a slow, comfortable breath. Now look around the room, name 5 things you can see. Take your time. Now, notice 4 things you can touch. Maybe it's your chair supporting you, your feet on the floor, the fabric of your clothing, or the cool surface of a table. Now listen for 3 things you can hear. Maybe it's the hum of a fan, birds outside, or simply the sound of your own breathing. Now, notice 2 things you can smell. If you can't smell anything, simply notice the air around you. Finally, notice 1 thing you can taste. Maybe it's the toothpaste from brushing your teeth, a sip of water, or simply the natural taste in your mouth. Now gently remind yourself, I am here, I am safe. This memory is from the past. Right now, in this moment, I am okay. Take 1 more slow breath. Open your eyes if they were closed. This exercise won't make PTSD disappear overnight, but with practice, it can help interrupt the brain's alarm response and gently bring your attention back to the present. If traumatic memories, nightmares, or insomnia are interfering with your life, please know that effective treatments are available and you don't have to go through it alone. Thank you for watching. I'm Dr. Ninth Tail. If you found this video helpful, please consider liking, subscribing, and sharing it with someone who may benefit. Sleep well, and I'll see you in the next video.